Do you have knee pain, or do you know that someone that has that bone-on-bone thing going on that doesn't want surgery or is tired of narcotics or steroid therapy? Then this is the video for you. One of my favorite things to help people with bone-on-bone knee pain. Hello everyone, this is Dr. Jason West, and we're going to talk about chronic knee pain, specifically bone-on-bone arthritis, which I get asked about all the time. Is one of my favorite things to treat because there's some amazing natural, non-surgical, non-prescriptive, non-narcotic ways to take care of knee pain. So let's talk about the knee joint itself for a minute. You got your shin bone here and your thigh bone here. What happens is it's going like this all of the time. And I don't know if you know that we're not born with kneecaps. What happens is we have a tendon attaching from the thigh bone over onto the shin bone, and when it rubs over that joint, eventually, I think it's around age 2, we start developing a hardened part of the tendon, which is the kneecap. Now, as we talk about the knee joint and bone-on-bone arthritis, one of the most common things to do is it's really hard to go up and down stairs because there's a membrane around each bone called the periosteum. When the periosteum, which is connected to all the nerve tissues, touch each other, it really hurts, it short circuits, it's not fun, so you have people go up a stair at a time, or going down an incline really, really hurts. Now, for a long time, I thought that the only way to take care of bone-on-bone knee arthritis was to do a total knee replacement. And I've learned that that's not the case because there are some really neat interventions that help the shock absorber that was previously thought that it was gone to actually make it so that the bones don't touch and the pain goes away. We've done this hundreds of times. There's video testimonials on it. The way that you take care of it is to do a regenerative injection therapy. We call this Prolozone procedure. Now, it's a complete opposite of cortisone. You don't want to mix the ZONE with the ZONE because they're 180 degrees opposite. Cortisone therapy, which is usually the medical treatment, is a steroid therapy which gets rid of inflammation. You can't do it repeatedly forever because it does have some effects to the cells and to the bone. But the regenerative injection therapy, the proliferative therapy using ozone, or what we call prolozone therapy, it's the exact opposite of that. And here's the big difference. The prolozone therapy, you take a vitamin solution with some oxidative medicine, you put the vitamin solution into the joint area, whether it's the knee, it works for the hip, it works for the shoulders, the elbows, the wrists. And what it does is it puts all of those building blocks into the joint space. Then you put like literally a construction crew to remodel the area with some oxidative medicine. I've seen with x-rays of people being bone on bone like this, and you do a series of treatments over 4 to 6 months and you'll see the space increase. Now, are you regrowing cartilage? I don't know. Does it really help the patient? It helps tremendously. It makes it so they can go up and down stairs. Knee joints are my favorite way to treat. You use prolozone therapy to do it. I've not seen any contraindications. I've seen really, really good outcomes for people literally that are scheduled 2, 3, 4 weeks before the first appointment, cancel the surgical intervention. The neat thing about this is if therapy doesn't provide you with relief, which most of the time that it does, but if it doesn't, medical recommendation is a total knee replacement, which you were going to do anyway, but there's a really good possibility that you're not going to need a knee surgery, or at the very least we can buy you some time and help avoid that surgical intervention. Now, some things that you can do at home for chronic joint pain. I really like a product from personalizeDNX.com. It's called Dynamic Duo. It's a mineral formula. And there's something called Liquid Joint Revive. It has some glucosamine and chondroitin. It has some proteolytic enzymes in it, which are little Pac-Man that eat up inflammation. There's a lot better natural ways than taking Tylenol, Aleve, Advil. There's some detrimental effects to those over-the-counter medicines. Also, the thing that helps is getting enough water, and I've said that on nearly all of the videos. Water really, really helps with hydration and helps with joint pain, and then getting rid of inflammatory foods. Sugars, refined sugars, junk food, soda pop are really, really hard on the joints. So there's a really neat way to take care of it. Regenerative injection therapy using prolozone therapy. This is Dr. Jason West. We'll see you on the next video.